Hey guys, Michael Pizzullo here. I'm a psychotherapist in West Hollywood. I want to talk to you about a really comprehensive plan for how gay men who've experienced sexual assault or sexual trauma can heal. So we know unfortunately that about 50% of men who identify as gay or bisexual have experienced sexual assault at some point in their life. So it's unfortunately really common, and it's something a lot of people come to therapy for, but they don't necessarily know what to expect in therapy or what the treatment will look like. So I want to give you a few guidelines of what you might expect if you're doing this type of work. And again, it's really individual, so you're going to want to work with a therapist who gets to know you on an individual basis, who knows your unique story and your unique needs. So this isn't general outline, and it's not going to be prescriptive for everyone in particular, but here we go. So a few things to start with. First things first is always going to be establishing safety. So that means making sure that you're not doing anything destructive. Right now, there's no active addiction, you're not in some sort of toxic situation. If you think about it, like, you can't put out, a fire while you're starting another. So first things first is going to be establishing safety in your life, making sure nothing destructive is going on. And then it's going to be adding in positive things too, more sources of support, healthy activities, things like that. The next thing is going to be an assessment, which will really be kind of like a sexual history. So when you go to therapy, always they're going to want to know about your background, family history, mental health history, so on and so forth. But when it comes to sexual trauma, what you really want to do is get a comprehensive sexual history as well. Learning about how you learned about sex, messages you got about sex growing up, your natural sexual interests, things like that are going to be really important, because you're going to want to see what your organic sexuality was like prior to the trauma, because the therapy ideally is going to get you back there is the idea. Next is going to be the meat and potatoes of the work, which is going to be what you think about in terms of processing trauma, which is a very vague word and a vague concept. But basically the way I think of it is, if you think of what did the trauma leave me with, what are my post-trauma symptoms, and then processing is going to, again, reduce those, hopefully get rid of them altogether, bring you back to where you were before. There's a lot of people who debate whether or not you can quote unquote heal from trauma or what that means exactly. And answers will vary depending on who you ask. But I would think about, coming back to some sort of organic sense of self and your organic sexuality, and, whether it's anxiety that you took on or, injuries to your self-esteem or whatever it was, that the therapy should be about reducing those as much as possible and getting you back to a place where you feel confident and secure and emotionally regulated as well. Then it's going to be about, developing confidence and sexual confidence really, and about how am I going to re-enter the world and explore sex in a way that isn't informed by trauma, but again is informed by natural curiosity, natural interest. So this is where you're going to want to learn about, setting boundaries, holding boundaries, again, like exploring your natural sexual inclinations and interests, and really getting back to the, sex should be about, organic expression and fun and, thrill and excitement and all those sorts of things. So getting back to that rather than something that's based in trauma. So that's going to be a really critical period, because it's going to be a little bit of, where the rubber hits the road. So you may have, moments that are tough there, and moments where therapy is going to be really crucial to help contain you if you get activated. So that's really the phase where things start to get put into practice, I would say. And then lastly, and this isn't really a phase, this is kind of like the ongoing stuff, is maintenance. So, it's like going to the gym, right? You put in a lot of work to get the results, but you do have to do things to maintain it. I think maintenance is way easier than the original work, but it is essential. So it's not necessarily the case that you will inevitably, backslide if you don't do maintenance, but I think it's good just to incorporate practices into your life to sustain the progress that you have and just keep you going in the right direction, so that you don't have to even worry about a backslide. So that could look like, again, like having ongoing mental health practices, whether that's therapy, even if it's less frequent, medications if you're taking them, groups you're a part of, meditation, gym, social support, whatever it is, just things that you've incorporated into your life that maintain your wellness and make you feel good about yourself and help eliminate or decrease any kind of PTSD symptoms you have as much as possible. So those are the 5 things that I would offer to you in terms of thinking about what to expect if you are a gay man looking for therapy or treatment for sexual trauma. And again, if you're struggling, please don't hesitate to reach out. This is a really complex, nuanced issue, and not a lot of people know exactly how to deal with it, so you're really going to want to work with a specialist on this. It's not like just sort of a garden variety depression where you can kind of, see anyone. You're really going to want a specialized person that understands the nuances of treating this sort of thing. So please reach out if you are in need of help, and I hope this was useful just to give you some ideas to get started.